think the first conversation I'm going to have to you is that I want to do a few things. Yeah? I want to share with you the concept of addiction. I want to share with you the pharmacological and also neurochemistry of the substance that we believe is the substance that keeps people addicted to the cigarettes that you were shared about just now. And I think the third one, which is probably the harder one, is to convince you that there's something called nicotine addiction. That the reason that people are smoking, they continue to smoke, the reason that people are using these new devices like electronic cigarettes is because of the substance within them that is common. Whether you are chewing tobacco, whether you are smoking water pipes, it is the nicotine that they place inside these products that keeps individuals going. And if you don't have that nicotine, theoretically these people will not have a problem with these products for the long term. Like you saw just now with the conversation that we had with Dr. Amer. So for some of you here who are eco-leavers, budak-budak nerd kat dalam sekolah, medical school students kan normally kena je, pharmacy school lebih kurang sama, dental school pun sama, nursing pun lebih kurang. This is going to be the key learning objectives that we're going to have. Yeah. Smoking is addiction to nicotine. Somebody was asking, can I get the questions before the questions are out? Roughly, these are going to be roughly the kind of questions. We just want you to have a real good understanding about the basics. Yeah. The second one is that we want you to at least have some idea about the pathophysiology of nicotine addiction. And I think to appreciate that addiction is just not neurochemical, it is also psychological, it is also environmental. And I'm just going to share with you a little bit about this so that conceptually as you're going through the treatments, you'll be able to see how can you apply this general knowledge into your practice later on. So I think the first thing is for us to appreciate that nicotine and nicotine use disorder is based on this product called nicotine. And more importantly, nicotine use disorder, which is the addiction towards nicotine. The official terminology based on the current available classifications that we're using is probably the most common form of chemical addiction in most countries, but definitely probably in Malaysia. Some countries, alcohol use disorder would be their most common addiction, but for us in Malaysia, it's more likely than not going to be nicotine use disorder, i.e. smoking cigarettes. And I think there are lots of research now to suggest that unfortunately nicotine addiction, which Malaysia has a big component, is probably more sticky or more addictive than some of the illicit drugs that some of you are scared to actually try. I don't encourage anyone to try any of the drugs. But I'm just saying that in terms of the drugs that we often hear about that causes problems, nicotine addiction is probably the most problematic one, just because it's highly available and it's legal in most of these countries that we are looking at. Now, when we look at the concept of addiction, for us who still might not be convinced that there is something called nicotine addiction, why is not smoking a habit? Why do you say it's addiction? Well, if you look at the concepts of addiction as we understand it, and how we make that diagnosis, and in Malaysia, the implications of addiction is very real. Because for those of us who have an addiction towards, say, for example, heroin or methamphetamine, the implications or the consequences of being addicted to these particular drugs is going to be detrimental. So you can't penalize somebody if they don't have a problem with addiction. Now, I'm saying that nicotine also can be addictive. It is not no more a habit because of these reasons. Yeah? So my professor, Professor John Salman, wrote a paper with my co-supervisor, Simon Adamson, looking at the concept of addiction, which is in keeping with what we understand about addiction now, and I'll share with you later. But it has 4 points. Yeah? The first is that individuals who have problems with addictions often have problems with discontrol, the inability to control their use. The second is that they often have primacy or salience. They prioritize the addictive material more than others. Yeah? The third is that they have compulsion to use. This inability to actually, it's almost automatism. They sometimes only use without actually knowing that they're using that particular drug of choice. And the final one is that the drug of choice or the non-substance behavior of choice causes them to have physiological changes. They often have something called withdrawal symptoms, and some of them will also have, or most of them will also have issues with tolerance. Okay. When we look into the WHO definition of addiction, we see the same four patterns happening. That the wording that's written by WHO actually indicates the four elements of addiction that we saw just now: discontrol, compulsion, salience, and physiological changes. Now, when we think about somebody who has a problem with smoking, I hope none of you here are smokers, but if you are, think about yourself and the issue of smoking. Do these people who smoke say they want to quit? And despite knowing the harms that we shared just now, the various harms, they still continue to smoke, i.e. do they have a discontrol issue? So if they do, they fulfill one criteria of addiction. Think about a family member who smokes and now you are in countries that are really cold or in the situation that we have right now, torrential rain. I mean, due to their quote-unquote addiction, they have to find a place that they can still smoke. Will they do so? Yeah. So if they are doing that, then they have the second element of addiction. Now the third one is that, think about that friend who you saw he's smoking a cigarette and he told you before he's going out with you, he just only smoked one. But without him knowing, he's already smoked three. And you're noticing this. Satu, lepas satu, lepas satu. Yeah? And then you tegur dia, you tell him, hey bro, dah tiga dah. Oh iya ke? He forgot that he's already smoked three. He didn't actually realize that he's already smoked three during the session that he's been with you. That's a third element of addiction. And of course the final one is going to be, have you noticed over your lifetime with this family member or friend that he's smoking more than he used to smoke before? 1, 2, 5, 10, 20 cigarettes a day now, just to fulfill some completeness of life that he thinks he has. Yeah? Dia punya purpose tu nak mati cepat kan. Kan semua orang tengah look for purpose. My clinic, everybody's looking for purpose. Doc, I tak ada meaning lah. Doc, I tak ada meaning lah. Okay. So dia punya purpose tu nak mati cepat kan? Because they keep on smoking more and more cigarettes. Yeah? So that's tolerance. And then of course finally when you stop him or her from smoking, they get very uncomfortable. The mood changes, they complain of certain physiological changes, so they are having withdrawals. So if they are fulfilling these criteria, this family friend of yours who smokes, this friend of yours who smokes, you who smoke, then therefore we can agree that there is something in the cigarette which is more likely than not nicotine, as we've seen just now from Dr. Mani's presentation, that is causing individuals to continue to smoke. And that's why we think that nicotine is an addictive substance. And we've studied it looking at many other components. Yeah? So again, we treat based on the diagnosis. So if you look in the DSM-5, which is at least the classification for mental health issues, and addiction is one of them. Within the various types of substance of abuse, nicotine comes in that category. And therefore, if you look at all the 9 or so criteria, they will be in keeping with the 4 themes that I shared with you just now. Yeah? Discontrol, compulsion, salience, and of course physiological changes. Now why is it addictive? Why is it so addictive? Well, like I shared with you just now, it's highly available. It's extremely potent, it's very sticky. It binds to the receptor that it binds a lot. Yeah? Because it's legal, you can dose up and down, and you can dose frequently and regularly. More importantly as well, it's got quite a long half-life that individuals that have this particular problem later on might have difficulties in actually stopping as well. And to a certain degree, if you dose yourself out properly, you rarely get acute intoxication. Okay? I sometimes have trouble with this because I remember when I was in high school, if you got caught by the discipline master, you are asked to smoke every single cigarette that's in the box that you got caught with. So kalau baru hisap satu, ada 19 batang lagi nak hisap in one go. Yeah? So I've seen friends that have vomited after lighting off all 19 in their mouth in that period of time. But to a large degree, most of us who might have trouble with cigarette use dose up over time. Yeah? But over time we will. And as a result of that, you often don't have the problem with the intoxication of NTCC. Now, individuals who stop will often report of withdrawal symptoms because of the changes that happens, and we'll look at those changes later. And these are some of the withdrawal symptoms that we report. There are acute withdrawal symptoms, there are mid-term withdrawal symptoms, and there are long-term withdrawal symptoms. Okay? The acute one is the irritable boyfriend for those of us here who have a boyfriend who smokes, who's not able to smoke. In fact, he's probably cursing some of you here for coming for this course. Kan? Kalau boleh jangan hantar. Kalau hantar tadi contohnya, mungkin tak bangunkan pagi tadi contohnya, macam-macam alasan because dia takut. Kalau dia dah punya isteri. Why isteri? Because 1 in 2 men smoke in Malaysia, roughly. 1 in 100 women smoke. So the odds of you marrying or going out with somebody who's a smoker is much higher. Yeah, kalau tak, the risk is a little bit lower. So katakanlah, you have that partner. This is some of the acute withdrawals that they will have if they decide to quit. Now the midterm ones are going to be things like mood changes, either little anxiety or irritability, and then the longer withdrawal symptoms are going to be things like weight gain, which we see in some of these particular individuals. Now, we know that nicotine binds to a receptor in a part of the brain, and we know that the relationship between that receptor and nicotine will release another byproduct called dopamine. Now, dopamine is a neurotransmitter of the brain. Its main goal is to cause pleasure. Yeah? When you take dopamine and it reacts in the reward system of the brain, you create a lot of pleasure. But dopamine has other effects as well. It works in the movement system, so lack of dopamine causes Parkinson's disease. Why is this important? Because some people have said that if you smoke, your risk of developing Parkinson's is much lesser. So I don't know whether dia berniat nak dapat Parkinson, so they continue to smoke. I'm not sure. Yeah? So that was one of the arguments. The second one is that dopamine also, as you know, might react with the endocrine system and often regulates prolactin. So that's another element that will come in. And I think the third one is that it also works in terms of just general emotions. Yeah? So again, similarly, it can cause those particular consequences. But as a result of the dopamine that is released, the brain is highly dynamic. It wants more of the good stuff. And these are the areas of the brain that we think that it's working on. It is going to be working mainly in the mesolimbic system, looking at these two areas, the nucleus accumbens, which is highly regulated for emotions, and to a certain degree the ventral tegmental area. Dopamine is highly potent. Pleasure is often sought by humans. It will affect your area which controls inhibition. So we normally have an area here which the prefrontal cortex, which is involved with control of what's good and bad, and dopamine can override that. Okay? And the third one is that it often works in the other part of the frontal cortex, orbital frontal cortex here, which also is implicated for motivation. And if you look properly where the nucleus accumbens is, it's very closely linked to the hippocampus, which is involved with memory. So I shared with you in the very beginning that addiction is not only a neurochemical response, but probably a psychosocial response as well. And the element of where the psychosocial comes in is from the retention of memories as a result of the consequences of the positive effect that you get from dopamine. So if you look again from this area, you can see that the dopamine pathway really works around the prefrontal and the mesolimbic system over here. And these are the main components that are implicated in the use of dopamine, which is also the main neurotransmitter that is released by all the other drugs and all the behaviors that we love to do in our brain. Yeah? So let's look at it from a chemical point of view. So dopamine is naturally released if we have great food. For some of us here who are foodie, what's the word? Live to eat, okay? I need just eat to live. I'm not a real foodie. Okay? Even though if you look at my Instagram, I post like gambar just to make people jealous. Okay? Makanan tu, tapi I'm not really a foodie. Foodie ni macam nak beratur 2-3 jam kan, just to get something to eat. That's a foodie. So theoretically, my wife is a foodie. I'm not. So I'm like a bit annoyed to wait so long just to have something. So she can do her thing, I can do mine. Yeah? But you can see that if you have great food, you increase dopamine. Sex is another pleasure of life. In fact, there was a study that was done in Japan about the pleasures of life. One of the reasons why Japanese have a poor fertility rate is that the pleasure of life is actually tasting good food. So sex is not even on the #1 list. So I guess the fertility level has dropped as a result of that. But again, you can see that the dip, the spike in increase of the dopamine is the same when you are introduced to these pleasures of life activities. Yeah? Now, if you look at some of the drugs of choice, you'll see almost a similar kind of response for dopamine. It might actually be more heightened as a result of the stickiness of that drug. You can see that for amphetamine, that spike. Cocaine, another amphetamine, you can see that spike. Morphine, not so much, but nicotine. We can also see this spike happening again. Yeah? Which also means that there is something in the nicotine that releases dopamine equally as effective as those things that we believe to be the pleasures of life. And therefore the brain says, hey, I want a lot more of that thing that you're releasing. Yeah? So as a result of that, it would do only two things. I will do a little bit of demonstration. So the first take home, one of the very important key messages here is that the nicotine will bind to a receptor called the alpha-4 beta-2 nicotinic acetylcholine receptor. Kalau takut saya nak seorang bocor, inilah seorang bocor. Nicotinic acetylcholine receptor. Why is it important? We'll see later. But it's very important receptor that is implicated in the brain. Okay? One receptor working on one nicotine and then releasing some dopamine, and then as a result of the upregulation, you'll have more of those receptors, and then subsequently when you quit smoking, you'll have more receptors than you have nicotine, and therefore you will have withdrawal. The upregulation process over time is called tolerance. You need more and more receptors, or more and more cigarettes to get the same effect again. And then once you don't have the nicotine and the dopamine, and you're only left with the receptors, you're going to get an acute response, which is going to be withdrawal to all of us outside. Yeah? And that's what we are dealing with. So when we look into some schema diagrams, we can see that this is a nice PET scan looking at isotopes on nicotine receptors. And once you take a puff up to one cigarette, all of those receptors are going to be covered by nicotine. So the nicotine is already radioactively labeled. So they already completed basically flooding all of the dopamine, the nicotine receptors that we saw just now. and by 3 cigarettes is fully full. So just to share with you that it is highly potent, that as little as a puff can lead you into the journey towards being addicted towards nicotine. Yeah? And you can see that it will take up to almost 3 months before you get almost a normal brain again. So this is the opposite. This is looking at the recovery. When you stop smoking, how fast do you get your brain back to your normal self? So this is a non-smoker. This is a person who, so this is the one. So often it will take up to 3 months for you to actually be able to recover. And again, this will conceptually be very important when we think about the treatments that we are going to recommend. Now, some of us here might not want to explain to our patients by nicotine receptor, so we look at staging. So a friend of mine over here, Diffranza, in the US, looked at some stages, and what he found was that individuals go through 3 stages before they become addicted, and they've done studies to correlate the stages with the levels of severity of dependence towards nicotine. In the first stage, he says that individuals who are not having a problem with addiction or dependence would often be in stage 1. In stage 2, when they have a little bit of mild dependence, they will be in the stage of wanting. When they are in a higher stage of dependence, they will be in the stage of craving. And when they are in the highest stage of dependence, they will be in the stage of needing. Okay? And this is often a way for you to assess clients who are unable to maybe read, because one of the tests to measure for dependence is going to be the FTND, Federal Test for Nicotine Dependence. But another way that you could is just try to understand. You perlu ke, you memang gian ke, you nak je. So it gives you an idea. For children, if you're assessing children, for our colleagues who work in dental, who have to do the assessment with children, this is one of the ways for them when they catch somebody who's smoking, trying to assess at what level of dependence these individuals have. Because there's an instrument that Professor Franza has made called the HONC, hooked on nicotine cigarettes, I think, which actually looks at these 4 stages of dependence based on the criteria that he's put in place. So his idea is that you've got this latency period that as you smoke more and more cigarettes, the time for you to have discomfort is shortened. And we can see that just now from the exercise that we did just now, that maybe the first cigarette takes a whole day before you feel a withdrawal effect. As you smoke more, you have the second cigarette, now the time is cut in half. If you smoke more, you have the third cigarette, and now the time is cut in the third, and so on and so forth. Yeah? So as you become more and more dependent, your time between each cigarette becomes shorter. 20 cigarettes per day is the average cigarette in Malaysia. So it's almost like in just about how many hours of waking. Some of us probably 12, some of us 16 maybe. That time is shortened, so every 40 minutes or so, you're going to feel the need because your body is feeling uncomfortable, and therefore you are probably going to be at that higher latency. The latency become much shorter and shorter over time. Okay? So what are some other reasons that people smoke apart from the biological basis that we talked about? So of course there's going to be some psychosocial elements that we need to appreciate. Yeah? There's a study that was done by Jarvis looking at a number of psychosocial motives. And these are some of the motives that were actually shown. And we've seen this over and over and over again. One of the biggest risk factors for young people to start smoking is going to be loved. I was in a meeting yesterday with the minister on reasons why people do certain crimes involved in gangs. And one of the reasons is to belong. And if you look into a lot of the other documentaries on gang membership, they have broken families and they want to belong, to comply, to be part of a fraternity, a tribe, and therefore they do some of those behaviors that the tribe has. So similarly, one of the strongest risk factors for our children and our friends' children, our nephews and nieces to start smoking is going to be peer pressure. Yeah? So the psychosocial element is extremely important. And one of the reasons for that is going to be the effect that they believe that cigarette has for them. Yeah? That cool effect, the calming effect, that ability to attract certain groups of people effect. And it also works for our young women, children as well, yeah? Whereby they want to be with the bad boys. There's a nice guy who is well dressed, earns a lot of money, tapi dia nak juga dengan the useless guy that earns no money, yeah? The bad boy. Yeah? So there's this psychological element that I don't want to go into. But that might also attract still young women, children to also maybe connect with these people who we know have certain behaviors that are not very positive. So kepada ibu bapa di sini itu kita tengoklah sikit anak-anak perempuan dan lelaki itu, just to give a bit of an idea. So some of the other theories of learning that is important when we talk about addiction is going to be positive reinforcement. I shared just now that dopamine is a very potent neurotransmitter. It causes you to feel the pleasure, likened to what we saw just now, sex and good food. Yeah. So the body wants, the brain wants good things normally. So positive reinforcement is a big driver for you to continue smoking. When you stop smoking, as we saw just now, you'll have a very negative reaction, withdrawals. So it's a negative reinforcement that also pushes people to continue smoking because they don't want to feel uncomfortable. That's why for some of us here who are comfortable and rich now, we don't want to be poor again. Okay? And that's why they talk about manifesting. Okay? Please buy the first suit, $1,000, naiklah first class, business class. Okay? Have you seen the Steve Harvey video about first class, which I follow diligently? Once you go into first class, you'll think about how to get back to first class. Because once you're in the cattle class, nakang economy itu, jauh-jauh lah tu, tersiksa nakang tu, teringat orang kat first class kan? Business class, yeah? So the negative reinforcement, the suffering really allows you to not want to be in that position. So in this scenario of our conversation this morning, kalau tidak ada withdrawal symptoms that are very bad, then often they don't want to be there. So what do? They continue smoking to continue not having the negative reinforcement that happens. And the third one is going to be cue-based learning. This is where compulsions happen. Dia buat benda tanpa disedari. The subtle sciences of marketing. The subtle sciences of marketing. Nampak yang merokok tu, nampak dia selalu cool. So, in the brain, without knowing, smoking is cool. Okay? Yang merokok ni semua nampak macam kaya. Kalau tak kaya, tak merokok. Subtly in the brain, I smoke, I'm going to be rich. Yeah? Yang merokok ni selalu didampingi ramai wanita jelita. Okay? So my brain, if I smoke, I'm going to have all these positives. The cue-based learning. Also, when you smoke, you have certain responses. You might be with friends when you smoke. So smoking equals to fun. Yeah? You might smoke and you get a positive reward in terms of what you are taking, the food, for example, that you're taking. So smoking causes my food to taste much nicer. So this is very important because when you quit smoking, smoking makes me poor. Quit smoking makes me poor. Quit smoking causes me to lose friends. Quit smoking makes the food not nice. Padahal the smoking causes the food to be tasteless actually. Yeah? Tapi the way that the brain has reacted and the way the marketing has played with our brain, this is the cue-based learning. Because it's really important when we're trying to look at the strategies to help them quit. So again, the environment also plays a huge part. We can see that ways of coping is also manipulated by smoking. We know that smoking, as you know, causes dopamine to increase. So people who are stressed, they try smoking, they reduce some of their stress, so they learn that maybe if they they take more cigarettes, then the stress will be lesser, therefore they continue smoking. Yeah? So when they stop, then they think that the stress will be higher, but actually studies show otherwise. So this is another way that the environment is applied and why it's important for us to control the environment as well. So I think finally, as I shared with you just now, I believe that smoking is an addiction, and the addiction is towards nicotine. Nicotine is highly potent, it releases dopamine. Dopamine causes pleasure. Stopping dopamine, i.e. stopping smoking, results in a negative consequence in terms of the body. And these are the areas that we need to look into. More important, nicotine binds to the alpha-4 beta-2 receptor to cause a dopamine increase in the mesolimbic system. And this is one component of it, but at the same time, as a result of the consequence of quitting, you have the negative reinforcement, also reinforcements of dopamine. And therefore, these are also areas that might drive people to continue smoking, apart from the cue-based learning that we looked at just now. So, in essence, I want to make the argument that nicotine is highly addictive and it's not a habit, because a habit is something you can control. Compulsion use is when you can't control that, and therefore we are dealing with an addiction, and as a result of that, the treatments that we'll be looking at to addressing the biological aspects and also the psychosocial aspects. So I think with that, we'll hand over here and pass the floor to my friend, Sweetwine. So Sweetwine is a pharmacist, currently with the MSU University. She's been doing the quit smoking service in UK prior to joining MSU. So when I met her, she was one of the instructors of the quit smoking clinics in UK. And now she's going to be doing a PhD, well, she's doing a PhD with me now in her first month of torture. And we'll be looking at the elements of cessation, but maybe another area of cessation. But I think what she has is about probably more than a decade worth of experience in helping people to quit. And she'll be sharing with you some of the pharmacological strategies in order to assist people to quit. And then I'll continue the conversation after her with some of the psychological methods to help people to quit. And then we will take all the questions that you have at the end. Would that be okay? All right, so thank you again, and let's welcome Sweetwine.